Hello and welcome to the Kuching Family Health Team's pre-recorded session on adult ADHD. The purpose of this video is to provide you with a brief introduction into learning more about adult ADHD, whether you have recently received a diagnosis and want to know more about what ADHD is and how to manage it, or if you have known about your diagnosis for some time but still have questions. There is a lot more to cover beyond what is included in this video, but we hope that the content here can help you get started. Here you will see an outline of what we will cover in this session. Today we will watch a couple of videos that help explain ADHD, executive functioning, and common challenges. We will also cover some information about prevalence, common myths, diagnosis, considerations specific to adulthood, and a little bit about the neuroscience, common co-occurring conditions, treatment options, and further resources beyond this video. First, we are going to watch the first 4.5 minutes of this video clip from the YouTube channel How to ADHD by Jessica McCabe, a person with lived experience of ADHD. This video provides an introduction into common challenges and helpful explanations to help us better understand executive functioning and how it looks different in someone with ADHD. She also briefly covers the 3 different types of ADHD presentations, which we will also further review later in this session.
Hello, brains, and probably people sent here by brains. I get it. It can be hard to understand ADHD and even harder to explain it to others. Most ADHD behaviors are things everyone struggles with once in a while. Losing your keys, spacing out during a conversation, forgetting to turn in an assignment. Sound familiar? Yeah, and when someone with ADHD does these things a lot, it's easy to assume that it means the same thing as if someone without ADHD does them. Once in a while is understandable, but if it happens a lot, they must not care, or not be trying hard enough, or not be very good at stuff. But before we judge their behavior or write them off as a bad whatever, it's important to remember behavior is affected by the brain, and ADHD brains develop and function much differently from average or neurotypical brains. Those differences can be valuable, which is why, as someone with ADHD, I wouldn't trade my brain for the world. But without the right support, they can also be incredibly impairing. The struggle is real. It's also invisible, which can make it very hard to see. So to help you understand what it's like inside the brain of your ADHD person, we reached out to our community of ADHD brains as well as the community at understood.org to ask how they explain it. For example, fun fact, despite the name, we don't actually have a deficit of attention. When we forget to change the laundry or have trouble focusing in class, it's because our brains have trouble regulating or effectively shifting our attention. So sometimes our brains jump from one thing to the next, and other times our brains actually zero in or hyper-focus on one thing, and it can be hard for us to pull ourselves away. As Eric Peterson puts it, neurotypical brains have a 1 through 10 dial they use to regulate their attention. With ADHD brains, our dials have 2 options, random and 15. And this applies to all aspects of our lives. The ability to regulate attention is part of something called the executive function system. It's kind of like our brain's self-management system, what allows us to plan, prioritize, and sustain effort toward a goal, say, making dinner, without getting sidetracked. It's what allows us to inhibit or not act on our impulses and ignore distractions so we can stay on task and switch when it's time to switch. In the ADHD brain, executive functions develop much more slowly than in neurotypical brains. And we have a deficit in the brain chemicals that help them function. So we usually know what to do and have the best intentions, but our executive function system isn't always developed or functioning well enough to effectively help us do it. And it's just as frustrating for us as it is for anyone else. Haley Melville explains it like this. Your brain is like a secretary, and you're the CEO in a meeting, doing a task. In a neurotypical brain, their secretary greets guests, potential distractions, lets them know that the CEO is in a meeting, and either encourages them to make an appointment or shows them the door. My secretary either lets everyone into the meeting, nor lets no one in, even if it's something important. Another executive function is working memory. That's our ability to temporarily hold information in our head so we can work with it. Like, look at a recipe and then remember the steps while we cook. It's our brain's version of RAM. Everyone has a limited capacity of working memory, but it's often more limited in those with ADHD, which is one reason we might blurt out an answer before we forget it, or ask you to repeat what you just said. Timothy Warnke says, "It's like my brain is a whiteboard, and I have to write down everything that's happening right away. But I write kind of big, so pretty soon I have to erase a bunch of stuff to make more room." By the way, that's also why we tend to have trouble following multi-step directions. It's also why Post-it notes are helpful. Another fun fact about ADHD, not everyone with ADHD is hyperactive, at least not on the outside. ADHD has 3 different presentations, and they can change over time. So even if someone doesn't look like they have ADHD, they still might. Even if they're not bouncing around the room, their brain might be. It's often referred to as internal restlessness, and it's exhausting. Diana DeVader Murray explains her mind like being on a hamster wheel you can't ever get off of. Deborah Cradaville says it's like a pinball machine with the ball constantly hitting and bouncing between all the bumpers. All this energy can be great when we can direct it well. It often shows up as creativity, generosity, curiosity. We tend to think outside the box, and we're 3 times more likely to start our own business. But for us to take advantage of our brain's strengths, it's important that we learn to manage our ADHD, which often means using a combination of medication and other strategies.
Now let's take a look at some numbers to give you an idea of how common ADHD is and to know that you're not alone. Based on studies listed here, the estimated worldwide prevalence of ADHD is between 2 to 7%. Statistics Canada has predicted that approximately 5% of children and 4% of adults have ADHD, and many children, about 2/3, will continue to experience symptoms into adulthood. These are only estimates, and recent research suggests that adult ADHD continues to be underdiagnosed, so the prevalence of this condition may be higher than what the current statistics show. ADHD is a condition that is often misunderstood. One of the most common myths that you might hear is that everyone has a little ADHD. And yes, it might be true that people in the general population can have some characteristics of inattention or hyperactivity that are seen in ADHD. However, only a certain number of people actually fit the diagnostic criteria, and this myth really does diminish the real-life impacts that ADHD has on those living with the condition. There are some other common myths when it comes to ADHD. These myths are important to address because they often stop people from seeking the support that could help them. First, people might think that ADHD is not a real disorder. We know that it is, and later we will further cover more about the neuroscience. People often think that ADHD only occurs in childhood and should resolve by the time someone is an adult, but we know this is often not the case. In fact, in some cases, symptoms show up more later in life, which we will discuss further in a few slides. Another myth is that ADHD is overdiagnosed, but again, as you saw on an earlier slide, it actually remains underdiagnosed. People may say things such as poor parenting causes ADHD, which again is not true. People may think that girls or women have lower rates and less severe ADHD than boys or men. However, it may actually be that girls are less likely to be diagnosed, or their symptoms of ADHD may present slightly differently than in boys. There is also a myth or stereotype that people with ADHD cannot focus. But as we learned in the previous video, ADHD is not an issue of not being able to focus, but more an issue of regulating or directing our focus. And sometimes people with ADHD tend to hyper-focus on certain tasks. Another very challenging myth is that people with ADHD just need to try harder. They're lazy. Whereas we know that ADHD is not an issue of laziness, but it is an actual chemical difference that alters how the brain functions. Lastly, another common misunderstanding is that everyone with ADHD is hyperactive, whereas we know that there are different presentations of ADHD, and we will discuss this more in a couple of slides. We will now discuss a little bit about the process of getting an ADHD diagnosis, and we will preface this by saying that the facilitators of the Adult ADHD Skills Group are not one of the regulated health professionals that can diagnose ADHD. Those that can diagnose ADHD include family physicians, nurse practitioners, or specialists such as psychiatrists, and criteria from the Diagnostic and Statistical Manual are used as a guide. ADHD is a clinical diagnosis that does not actually require neuropsychological testing in most cases. Often, the assessment will involve looking back at historical information, for example, experiences from childhood or school, and speaking with collateral sources such as parents or other family members to gather required information. Sometimes there can be challenges in getting a diagnosis as an adult. For example, occasionally institutions such as universities require neuropsychological testing, which is not always readily available. Most adults do not meet the DSM-5 strict definition of ADHD, but would have as a child and still have persistence of symptoms into adulthood. And ADHD often coexists with other health conditions such as mood or anxiety disorders, which can make it difficult to tease out the symptoms. This being said, many adults are getting diagnosed later in life, which may be related to increased awareness of ADHD in recent years, as well as more available resources. In some cases, it may be that symptoms were less obvious in earlier years, perhaps related to support or strategies that were available in childhood. However, with a change in life circumstances, symptoms may be more pronounced in adulthood. In addition, we do know that there is a fairly large genetic component in the etiology of ADHD, and sometimes it's children or young relatives that are being diagnosed and then raises other family members' awareness of their own symptoms. Here we have an overview of the 3 types of ADHD presentations, and as already mentioned, the DSM-5 is where these symptoms and the diagnostic criteria are laid out in more detail. The first type is predominantly inattentive, and some common challenges include paying close attention to details, sustaining attention in certain tasks, difficulty listening when others are speaking, following through on instructions or finishing an assigned task, organizing activities, for example, if the activity has multiple steps, keeping materials in order or completing the task in a timely manner, losing things that are necessary to get things done, such as paperwork, supplies, or tools, being easily distracted, for example, by noise or other stimuli in the environment, or even by one's own thoughts, and being forgetful of certain daily activities, such as getting chores done, paying bills, etc. And again, these difficulties are not purposeful, but are related to a problem with the brain's ability to regulate attention. The second type is a predominantly hyperactive or impulsive presentation, and common challenges include fidgeting often, such as tapping of the hands or feet, or squirming, difficulty staying seated when this is expected, for example, at school or at work, difficulty engaging in activities quietly, often being on the go, or the person may describe feeling as if they are driven by a motor, talking a lot or talking over others, waiting for a turn may be challenging, and there may be a tendency to interrupt others, for example, cutting into a conversation or taking over a task that someone else is doing. Lastly, there can also be a combined presentation where several inattentive or hyperactive impulsive symptoms are both present. If you have received a diagnosis of ADHD, you likely would have been told which type of ADHD you have, and this can help when it comes to treatment planning and knowing what types of strategies and supports will be most helpful for you. It is also important to note that no 2 people who are diagnosed with ADHD are exactly alike in their symptoms. Therefore, what works for one person might not always work for the next, and it might take some time to fully explore what solutions work best for you. As mentioned earlier, there are many cases where a diagnosis of ADHD may be received later in life. Perhaps you have just recently received a diagnosis, and that is why you are here. Your situation may be one where symptoms were less obvious in childhood, related to support or structure that may have helped keep symptoms fairly well managed until more recently. Or perhaps your situation is one where you have always struggled with symptoms that were not recognized or were misunderstood for something else. Often, ADHD symptoms can become more pronounced in adulthood, related to changed life circumstances. In adulthood, we experience a large shift where cognitive demand significantly increases. We have more responsibilities. We often experience big life transitions, such as post-secondary education, moving out or living independently, starting a new job, changing careers, parenthood, etc. And through these big transitions, we may not have the same support that we did in childhood. There is also often higher expectations in adulthood, such as social norms that say, you should know how to do this. However, as discussed earlier, ADHD is often a lifelong condition, and symptoms do not just resolve when we become an adult. As we can see from this diagram, there are many other psychological conditions that may be present in addition to ADHD, such as anxiety, sleep disorders, depression, mood disorders, autism spectrum disorder, substance use, and learning disabilities. Research shows that approximately 80% of adults with a diagnosis of ADHD have a co-occurring condition, and often it is the co-occurring condition that leads adults to seek out help in the first place. Here we have the ADHD iceberg diagram that is borrowed from a course by occupational therapist Adam Lai and psychiatrist Dr. Mammoliti. As you will see from this diagram, there are often symptoms above the water that others are able to observe, including inattention, hyperactivity, and impulsivity or emotional dysregulation. However, there are often also a lot of other internal factors below the surface that others cannot always see, including poor sleep, feelings of overwhelm, sensory sensitivities, and so forth. And these effects can contribute to the impacts that ADHD has on our daily functioning. We will now discuss a bit about the neurobiology of ADHD. And the prefrontal cortex is the area at the front of the brain that is responsible for regulating attention, behavior, and our executive functions. And we know that the function of this area of the brain is different in those with ADHD. A detailed list of executive functions are listed here on this slide, including organization, planning, inhibiting distraction, and so on. And as mentioned in the earlier video, this area of the brain is like the conductor, the manager or the boss of the brain, and it organizes and tells the different functions of the brain what to do, when to do them, and how to work together. And these executive functions are important because they help us create a picture of a goal, a path to get to that goal, and the resources that we'll need along the way. They also help us remember the picture, even when other events occupy our attention or take up space in our memory. So throughout the 6-week ADHD skills group, we will be discussing various external strategies and tools that can help improve these functions. And the more we use them, the more we can reinforce these pathways in the brain. We also know that people with ADHD are lacking in dopamine and norepinephrine, which are neurotransmitters within the brain that are involved in reward processing, motivation, and pleasure. And with lower levels of these neurotransmitters, people with ADHD are chemically wired to seek more. Therefore, they often have difficulty with boredom or tasks that become too difficult and tend to seek out tasks that bring more reward or pleasure. We will now watch the remainder of the previous video from the How to ADHD YouTube channel, which offers additional analogies to help explain how the ADHD brain functions. This section also explores how ADHD affects emotional regulation and social interactions, while encouraging the idea that greater understanding of these challenges can lead to increased acceptance, self-compassion, and the development of stronger self-confidence.
ADHD expert Dr. Ned Hallowell explains it like this. Having ADHD is like having a race car engine for a brain. It's very powerful and it can propel you to win races. There's just one problem. You have bicycle brakes. But with the help of a brake specialist, you learn to strengthen your brakes and control that powerful engine. Then your race car stops spinning out on turns and starts winning races. Because we do tend to crash a lot while we're building up those brakes, those of us with ADHD tend to get corrected or teased more often than our peers. And unfortunately, another aspect of ADHD can make that extra painful for us. Our brains don't just have trouble regulating our attention, they have trouble regulating our emotions too. Jennifer Peterson explains, when it comes to emotional dysregulation, it's like I have a really bad sunburn. Even a playful slap on the back hurts so bad. If you didn't know some of these things about ADHD, don't worry, I didn't either until a couple of years ago, and I actually have it. I thought I was just too sensitive, or a space cadet, or weird, because that's what I was always told, and I'm not alone. That's why ADHD Brains made this video and why we hope you'll share it. When our ADHD symptoms are seen as personality defects, it can be hurtful, and worse, we believe it. It takes a huge toll on our self-esteem and can lead to other conditions like anxiety and depression. And honestly, it's really confusing. As Comiendo Biscocho puts it, it's like being the smartest, stupidest, most motivated, and laziest person in the room, all at the same time. But if we and others understand what our challenges are, we can accept them, find strategies to help us work through them, and more importantly, stop beating ourselves up about them so we can focus on more important things, like what we're good at. And we can stop writing off ourselves or others for being different and start appreciating what that difference can bring to the world.
In terms of treatment options for ADHD, there are several to consider. First, you may speak with your doctor or the healthcare professional that provided you with your ADHD diagnosis to discuss the option of medications. Second, counseling or therapy may be helpful to help you learn more about your condition, cope with troubling symptoms, improve your relationships with other people, and make positive behavior changes. Lifestyle is also a really big part of ADHD management, and some changes that can be considered include things such as increasing exercise or physical activity, adjusting sleep routines, and proper nutrition and nourishment is also very important. These pieces really are critical and often can make a significant impact. Lastly, there are several self-help resources available, such as books, podcasts, websites, and other online material. On our final slide here, we have a list of a few resources that may be helpful beyond this video. We encourage you to take a look through these resources if you're interested in doing some more self-guided learning. And this brings us to the end of this pre-recorded session, and we really hope that you've been able to take at least one or two things away from this video that will help you on your journey. Thanks so much for listening.